Assalamualaikum, viewers. Good morning, good afternoon, good evening, wherever you're from. You're most welcome to today's episode of the Aijaz Qureshi Show. I welcome you all who are watching us on our Facebook page, YouTube channel, and Twitch TV channel. Thank you so much for hopping on the Aijaz Qureshi Show. Today we're going to talk about neurodevelopmental disorders, why they happen, and what is the root cause, and how we can manage those neurodevelopmental disorders or neurodisorders, such as autism, ADHD, and some learning difficulties, especially when it comes to your children, because children have different mental level and mental status, and with that, if they are suffering from these neurodevelopmental issues, things become very difficult. So this show is for the parents who have such a gifted child or children, and this show is for the people who want to know more about the information regarding neurodevelopmental disorders and issues in people. For this, we have invited our esteemed guest, none other than Miss Asma Ahmed. She is from Karachi, Pakistan, and she is a consultant clinical psychologist, and she is the master trainer. She has over 14 years of experience in serving humanity and humankind by providing, she has been raising awareness through her sessions, providing trainings and guidance and counseling to people. She has expertise in providing training workshops, delivering lectures, psychoeducation, and counseling. She has successfully developed innovative training programs that she delivers, and she has apps for special need children, consultation for autism units, etc. And she is, by the way, a very keen observer, and she has a very strong communication skill, and she possesses empathy with the help in developing a strong relationship and effective networking with people, especially with her clients who are seeking her help. Without further ado, let's welcome our esteemed guest, Miss Asma Ahmed. Assalamu alaikum, Miss Asma.
Assalamualaikum.
Welcome,
Assalamualaikum,
Asma.
sir. How are you?
I'm good. Thank you so much. Thank you so much, first of all, for hopping on the show, Miss Asma Ahmed, and taking this opportunity to really educate our viewers and our listeners about the neurodevelopmental challenges and disorders and issues that people have at various stages. Today's topic is very, very interesting. We will definitely be exhausting this topic in detail. However, before we do that, we would like to know more about you. So, first of all, if I take you to your childhood, 3, 4, 5 years old, Asma Ahmed, what comes to your mind? What is the earliest childhood memory? क्या याद आता है आपको?
Thank you so much, sir, for inviting me and giving me an opportunity to talk about such an important topic on your show, which
Thank
has been seen across the world, not only in Pakistan but across the
you.
world. And yes, childhood memories when I was 3 or 4 years old.
Mm.
I can see my brother with me, and I can see a very shy little Asma, very
Ah,
small.
अच्छा.
Yes, I used to
Wow.
be a very shy girl.
Younger brother or elder brother?
Elder brother.
Oh,
I had three brothers, but now two. One of my brother left, who was a special child himself,
oh, oh.
and he's the one who used to be always with me,
I
sleeping with him, going out with him, studying with him, everything with him, eating
इन्ना
with
लिल्लाहि व
him.
इन्ना इलैहि राजिऊन। अल्लाह ताला उनको जन्नत में आला मुकाम अता फरमाए। हमारी बहुत सारी दुआएं आपके लिए और आपकी फैमिली के लिए। I know it's a big loss
Indeed.
which cannot be filled by any material thing, unfortunately. That's the thing. So was that the turning moment for you to decide to study psychology and help humanity? That must be it then.
Well, most of the people think that it is because of my brother that I
Huh,
am in this thing. It may be
huh,
because you can say unconsciously or somewhere back in the mind, it's like
yeah,
that. But
true.
the turning point, what you're actually asking, is that when I was in graduation, I had a lovely mentor, Miss Amna,
Hmm.
who actually taught us psychology, major psychology in
Acha.
graduation. So
Hmm.
I developed a lot of interest in psychology, but when I applied for masters, I applied an MBA. At that time, human resource management was very much in thing, and I applied for MSc applied psychology, English literature, everywhere, because I
Acha.
had interest in all these domains.
Okay.
But I think it was because of my mentor that I chose psychology and I went towards MSc applied psychology, and further I did my specialization in clinical psychology. And yes, definitely this would have been back of the mind that my brother suffered, and we all as a family faced many challenges having a special needs child, but we still feel ourselves blessed, and undoubtedly we were blessed and we are still blessed. And I feel कि बहुत सारी चीजें ऐसी हैं जो पहले भी उमर was my brother's name, कि बहुत सारी चीजें थी जो उमर की वजह से बहुत आसानी की तरफ चली जाती थी, एंड अभी भी आई कैन वेरी इजीली से कि बहुत सारी चीजें ऐसी हैं, या मैं अगर इस वक्त बहुत सारे पेरेंट्स के साथ एम्पथाइज कर पाती हूँ या उनको बेहतर तौर पे गाइड कर पाती हूँ, तो दिस इज
Because
बिकॉज ऑफ माय
you have
ब्रदर.
been through that. Ah.
Yes, I actually, we all, my family, my parents, me, my brothers, we all went through it. So I can very well understand, empathize with them, okay, what they are going through right now,
I know.
and guide them accordingly.
I know. I know. I know. How old was Umar when he left us?
Well, he was about to turn to 28 years old. That
Oh,
was in 2012,
that was in
9
2000.
years.
Oh my goodness. Oh my goodness.
Yeah.
I know. I mean, I feel the pain here, Asma. And as I said, I mean that's a gap that Umar created that can never, ever be fulfilled. But again, that's life, and he is at a better place, and he's watching you, and you're doing amazing work related to similar issues that he had, and you're helping the humanity and humankind, and you have a soft corner for such people who are going through this, and their parents. That it becomes challenging to handle a special child, and it's a change in the lifestyle actually that people have to make. They cannot move freely. They have bindings. They have extra responsibilities, especially the parents and the siblings, of course, because if there are siblings who are grown up, then they have responsibilities too. Awesome, 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 great. You're doing so many things, and you have your own kind of a patented training program that you have created. Tell us all about that.
Well, when I started my professional life, that was way long ago, 14 years back. At that time, I started with the children who were with special needs in children hospital. Then I also worked with adults who had some psychological concerns like schizophrenia, depression, etc. Then we also went through community rehabilitation centers. A lot of training was done. But
Hmm.
when I came to Autism Spectrum Disorder Welfare Trust, the organization I'm currently working in,
Hmm.
I developed many of the training programs for children who are with neurodevelopmental disorders. These include behavioral modification therapies. Then they have individualized educational plan. I have 2 days training workshop for that. Then I have DIR flow time training management series. It's a series of 4 to 5 days at least.
Wow.
Reason being, I actually got certified from US for DIR flow time, and hardly there is anyone in Pakistan. Hardly one or two people are there who are actually
Okay.
certified with DIR flow time. And then I also developed a proper social skills training program, which is hardly available again because work for autism on adolescence and adulthood, that is hardly done over there.
Yeah.
So I actually implemented on few clients and then developed the whole training module of social skills training. Then there are many others like I deliver many awareness sessions for autism spectrum disorder, for ADHD, learning difficulties, and many other training programs like developing applications for children who are on the spectrum or who are with neurodevelopmental disorders,
Yeah.
and then providing consultation for development of applications, because there are
Mm.
many university students who are actually developing these projects, who are with IT or who are doing BSIT or MSIT. So for
Hmm.
they are actually developing all these kind of applications, and I provide them consultation that whether the programs or games or the programs they are developing for these children, are they actually useful for them or not,
Working or
because
not
they are
working.
not
Yeah.
aware of their special needs or their different abilities. So we actually analyze, are the programs appropriate for them or not.
Awesome. Awesome.
Yeah.
Let me ask you this, Ms. Asma. Do you get emotionally attached sometime to some clients? Because you can feel their pain. Do you get emotionally attached?
Being a professional, it's not actually correct.
Uh,
Reason being that we call it transference in our technical term.
okay.
So it shouldn't be like that. Transference and counter transference.
Yeah.
Transference is actually from the client side, that they develop some emotional attachment to the therapist or the
Yes.
professional, or a counter transference is that if the therapist develops some emotional attachment with the client.
Huh.
So technically this is not supposed to be done, but to an extent, for the sake of your rapport building, you need to connect with the client. So yes, it is
Ah,
actually there, because unless you connect with the client, you can't work with them. You need
right.
to have that rapport with the client, so that you can actually work and implement strategies, so that they can further move positively towards the
Absolutely.
therapeutic intervention.
Absolutely. Let me share a story of mine and my dad. Actually, he's no more in this material world. He left us a few years ago.
Sorry.
We used to go. I used to live in Karachi, Gulshan Iqbal Block 2, and
Okay.
near Moti Mahal. And there was a doctor named Salim Adil, and his wife, Dr. Tazeen Adil. She used to have a maternity home and a women's clinic, and Dr. Salim Adil used to have his practice. And so he was our family doctor kind of thing. We always, no matter where we lived in Karachi, we would always go to Dr. Salim Adil. Now, when and this is how he treated patients. When the patient gets into the room, he would not talk about the illness or whatever. होता है ना डॉक्टर पूछते हैं, okay, what's going on? Tell us what's going on. He would never ask what's going on. What he's going to do is he used to, talk about life, talk about different stories and things like that. And it looks like that he had all the time in the world, no matter how busy is the waiting room out there, but he would give his full attention to the client that is presently available in his consultation clinic. And my dad used to go see him for different reasons, for different illnesses, and he used to see other doctors too, and or he has seen other doctors before. But after that, after seeing Dr. Salim Adil, he gave him a name and I'll call it in Urdu. He said Dr. Salim Adil is Qissa Go, a storyteller, because so he is such an amazing doctor. I wish him all the best in his future career. He must be, uh, he was way elder than me, and I'm not sure how old is he, or he's still alive or not, but such an amazing doctor. I have never come across such an amazing doctor in my life, to be honest. And that's again, connecting with people mentally,
Yeah,
and then आधी बीमारी तो वहीं ठीक हो जाती है. The half of the illness goes away as soon as you start talking, and somebody
exactly.
is getting things out of their chest, and they already start feeling better.
And you need to give them a lot of positive energy.
That-
Every day we do that,
exactly.
and we could feel, okay, actually it's going towards them, and they go very happy whenever they leave. The same story is with me whenever parents are coming over to me, and initially, as I think you know about it, that people or parents are usually in denial whenever they come with these kind of issues,
Yeah.
with children having these kind of issues. The first thing that they come with is denial. They don't accept the fact that the child is actually suffering from some kind of disorder or disability or different ability. So we need to guide them, counsel them, psychoeducate them, and the process is not easy either, neither for us not for them, because they cry and everything is going on in the room. So it takes time, but definitely बहुत सारे पेरेंट्स आते हैं, वो ये कहते हैं कि मैम आपने आपने हमें इतना सारा अपना टाइम दिया, एंड वी फील रियली रिलीव्ड, हमें बहुत
Absolutely.
अच्छा लग रहा है आपसे बात करके. तो दिस हैपेंस, but you need to connect with the client. That is very important.
Great. All right, so let's head to the topic, which is a very interesting topic, and I'm sure you're aware, Asma, that the mind and being so illiterate person, me, I have bundled so many things into one category, and I call it mind sciences. And psychology, psychiatry, Reiki, telepathy, all these 4D, these things, I call them mind sciences. And this is one of my favorite, branch or area where I like to talk about. Are you still with us? Okay, I think the connection disconnected. All right. So let's see when our guest is back. There are load shedding issues back home in Pakistan, so sometimes it suddenly happens. And all right, so you are back. All right,
I'm
cool.
so sorry.
No,
Power outage.
yeah. I can understand that. I can
Yeah.
understand. I have actually lived through that. So yes, yeah.
Exactly.
So neurodevelopmental disorders. Let's define it. Are they these issues like autism, ADHD, learning difficulty? Are they genetic and they are transferred from within the family, or they are developed over time?
Well, neurodevelopmental disorders, they are actually बहुत मैं क्योंकि हमारी ऑडियंस पेरेंट्स होंगे या प्रोफेशनल्स भी हैं, तो इवन
Ah,
देन आई वुड
yeah.
लाइक टू सिंप्लीफाई द वर्ड, क्योंकि बड़ी
It-
टेक्निकल टर्म लगती है. न्यूरो डेवलपमेंटल डिसऑर्डर बड़ा हैवी
ah,
वर्ड लगता है.
no,
न्यूरो इज रिलेटेड टू योर ब्रेन एंड
brain.
डेवलपमेंट इज रिलेटेड टू योर नशोनुमा, ग्रोथ एंड डेवलपमेंट. सो
ठीक
इट इज एक्चुअली दीज आर द डिसऑर्डर्स. ऐसा नहीं है कि ये बाद में डेवलप होते हैं. जब बच्चा अपनी मदर की वूम में होता है, ड्यूरिंग द प्रेगनेंसी, दीज डेवलपमेंट न्यूरो डेवलपमेंटल डिसऑर्डर्स start from the time the child is in the womb of mother, right? But
अच्छा.
the thing is कि इसमें बहुत सारी कैटेगरीज आती हैं न्यूरो डेवलपमेंटल डिसऑर्डर्स में. हम ये कह सकते हैं कि होते तो ये शुरू से ही हैं, जब बच्चा ओके okay. होता तो ये जो न्यूरो डेवलपमेंटल डिसऑर्डर्स हैं, ये वूम में
We are having some network difficulties, viewers. All right, let's give her a minute. As soon as the network stabilizes, she will be back.
can you
All
hear me?
right. Yes, now I can hear you.
Okay. I was talking about neurodevelopmental disorders.
Yeah, you
Neurodevelopmental
said it
disorders.
happens as it starts in the womb of the mother, right?
Exactly, they start in the womb of the mother and during pregnancy जब ये start हो जाते हैं. But उसमें ये है कि जब बच्चा पैदा होता है, after the child of the birth, at times parents उसको identify नहीं कर पाते, क्योंकि unless बच्चा behaviors exhibit करता है थोड़े different, तब तक वो नहीं पकड़ पाते हैं. खास तौर पे अगर पहला बच्चा हो, तब तो वो parents और नहीं इस चीज को recognize कर पाते कि the child is different from other children, because
Exactly.
उनके पास में comparison नहीं होता. अगर second
Right.
या third बच्चा हो, तो उसमें तो easily आपके पास एक comparison आ जाता है. सो न्यूरो डेवलपमेंटल डिसऑर्डर्स होते तो शुरू से ही हैं, बट अगर लेटर इन लाइफ बिहेवियर्स एग्जिबिट करते हैं, तो हम उसको लेटर इन लाइफ ही डायग्नोज कर पाते हैं. मेजॉरिटी केसेस में हम उनको पहले या वूम के अंदर डायग्नोज नहीं कर सकते. लेकिन जैसे डाउन सिंड्रोम है या इस तरह
Sorry, viewers, we are having some network issues here. As soon as the network settles down, she will continue talking. Apologies, sometimes it happens because our show is online live show, and it's all dependent on the network. So if the network is not as stable, we have these kind of issues. Sorry about that. All right. As soon as she will be back, as soon as her network stabilizes. I think the network is still unstable. I don't see her. But as soon as she's back, I will definitely be talking to her. Extremely sorry for the inconveniences caused. I know at times it's just hard to, deal with the network issues, but let's see what happens. So I've sent her a private message, and let's see what she says. All right, she's back. All right.
I'm really sorry.
No, it's okay. It's okay. We can understand. All right. So you said that the doctors cannot identify if the child has any neurodevelopmental issues at the time of the birth until the child starts showing some different behaviors, right?
Exactly, later
So
in
that's
life,
where
like
we got.
after like 1 year or when the child is 1.5 years old or more, then the
Yeah.
child starts exhibiting different behaviors. So then
Yes.
you can actually identify that the child is behaving in a different manner as
Yes.
compared to a regular typical child.
Okay.
So
So
these are
before
there
we
are
before
sorry.
we head on, the you said these kind of disabilities or disorders, they are developed uh, into the womb of the mother. Are there any contributing factors that cause these kind of disorders? Because here in the West, you know, alcohol is something which is a very commonly consumed commodity, and people socially consume alcohol, or they are either in the habit of taking alcohol, especially with food and things like that. And pregnant mothers or women, when they consume alcohol, it has some negative impact on the
Yes.
child that is still unborn. But back home in Pakistan, what do you think? Are there any other external contributing factors that can cause these type of disorders?
Well, as far as neurodevelopmental disorders are concerned, many of the disorders, they all have different causes. Especially when you talk about autism, there is no known cause for that. But yes, for
Uh, we lost her again. I don't know what to say. It's a very interesting topic, and I'm really keen to deliver this show today to you guys so that it can help people who have children with these kind of disorders. But unfortunately, the network is not really helping us today, unfortunately. But let's see. I'm not going to give up on it that easily. But as soon as she comes back, all right, we are back again. All right.
I was telling about the causes.
Yes.
Autism, when you talk about autism, there is no known cause for that. But if you talk about ADHD and learning difficulties, so yes, there could be genetic predisposition in your family. आपकी family में already किसी के अंदर learning disability पाई जाती है, तो yes, आपके घर में अगर पहले से है तो फिर आपके फर्दर बच्चों में भी हो सकती है, या जो नए आने वाली जनरेशन है उनमें भी हो सकती है ट्रांसमिट. तो दिस इज द इनहेरिटेंस or genetic predisposition. There can be some environmental factors as well, like you just said that alcohol consumption.
Sorry, viewers, we have network issues again with the guest, and it's just at times it becomes frustrating for the viewers. I know, I can understand. I've been there. When the guest is talking and disconnects from the show, unfortunately. But let's see what happens. If she's back, then we can definitely deliver. And as I said earlier, I'm very keen to deliver this topic today and this show, because it's a very important topic, and I'm sure that there will be lots and lots of takeaways from this show for the people who unfortunately have their either children or their siblings or someone, their loved one, who is going through these neurodevelopmental disorders, so that they can take away some good chunk of information that can help alleviate most of the problems in life related to autism, ADHD, and learning difficulties. So we are waiting for our guest to come back, and we will try to again continue from where we left. Unfortunately, this is something it is unavoidable. It's uncontrollable. These network issues, they just pop up, and especially these days when everybody is going through this pandemic, everybody is at home, and our show runs at the prime time, as you know, because we want people to come to this show, and they have to come out of the सास बहू का झगड़ा और ननद और भावज के मसले मसाइल के जो ड्रामे और इस तरह की चीज़ें चलती हैं. We have to really divert people's minds to something productive, something very interesting to learn about. And it's all about learning. Life is all about learning. We keep learning until we die. And This is exactly what we are trying to do here, to bring a, a venue and an opportunity to learn new things, which will definitely expand our mental horizon, and we will come across and get to know things which we did not know before. So that's all about learning. Learning, especially new things, are important. So uh, let's see. She is back. Asma, let me advise you, if you have any other device near your device that you're going live with, turn that device off, because sometimes these Wi-Fi data signals, they just cross, and that happens. So if you have a
Light is
laptop
back.
running, shut it down.
Let me tell you,
Yeah.
the power is back, light is back. So
Um,
no more issues.
okay.
Data was not working actually properly.
Okay. All right. Okay, but make sure that you have no other devices running near this device that you're going
Okay.
live with. Okay, sounds good. All right, so where were we? I lost.
Causes.
Yes, yes.
So I was telling that as far as autism is concerned, there is no known cause for autism. We can't say कि इस वजह से autism होता है, because till now we are not able to identify the reasons कि autism क्यों हो रहा है. But if you talk about attention deficit hyperactivity disorder or learning difficulties or other neurodevelopmental disorders, so yes, there can be genetic predisposition or inheritance if there is a child who is suffering from the family already. So the further generation है तो उसमें भी transmit होने के chances positive होते हैं, हो
Hmm.
सकता है. सेकेंडली देयर कैन बी एनवायरमेंटल फैक्टर्स. जो लोग लेड एरिया या लेड पॉइजनिंग एरिया की तरफ ज्यादा रहते हैं, फैक्ट्री एरियाज की तरफ रहते हैं, उन वहाँ जो मदर्स एक्सपेक्टिंग वुमेन हैं, उनके अंदर चांसेस होते हैं कि डेवलप हो सकते हैं ऑटिज्म. और ऑटिज्म जो है वो
All right, we have some network issues again. Gee, Asma, I sent you a PM actually. Uh,
yeah.
should we stop here and do our show at another time, because the continuity is important, and I don't think it's going to work, because back and forth, it doesn't really help. We
Yeah.
we lose viewership. People, uh, they see me every day, so no, they're not interested in seeing me only, but they're interested in learning new things from our guests. What do you say?
True. Sure, we can go ahead with it the way you say. Either way.
Okay, so if now, if you disconnect next time, I'm going to end the show and we'll reschedule it. Okay.
Okay.
Until then, let's keep our fingers crossed and see if we can do our show.
Sure.
All right. So
So
please.
I was telling about the causes, right? So there was genetic predisposition, then environmental factors, lead
Yes.
poisoning area की तरफ अगर parents expecting
Ah,
women रह रही हैं तो वहाँ पे chances हो सकते हैं. And
right.
then alcohol, like alcohol consumptions by the expecting women, or nicotine consumption, that could be a reason. Or toxins, which are quite common across all around us. Toothpaste हो गई हमारी, everywhere, phenyls, toxins are all around us.
Mm,
So these all could be the reason, but and then premature birth, they are all different factors. And if you talk about ADHD, there are some neurotransmitters as well. The imbalance of norepinephrine and dopamine, they may cause ADHD as well.
mm.
Yeah.
Right.
So, but in autism, there is no known cause. So you cannot actually pinpoint that this is the reason जिसकी वजह से ये वाले neurodevelopmental disorders हो रहे हैं, intellectual disability है. You can't pinpoint this is the only reason. There can be many reasons.
तो ऑटिज्म
country building
स्पेक्ट्रम
factor.
डिसऑर्डर और ऑटिज्म क्या दोनों एक ही चीजें हैं या अलग अलग चीजें हैं ये?
Very good question. The both of them are same. Autism
सेम।
is kind of an old term, but autism spectrum disorder is the latest term which is used for autism. ASD. It is a
हाँ।
spectrum of disorder. Initially, it used to be a classical autism only. Now it is a spectrum of disorder because all conditions similar to autism, like if they are like high functioning, mild, moderate, severe, all lie under the same spectrum.
अच्छा, बहुत जबरदस्त। तो let me ask you this: is there any diagnostic schemes for persisting receptive language disorder? एक और disorder है which I came across a few months ago, and which is non-autistic actually.
Yeah, not at all.
And these adults in adult psychiatry, is there any diagnostic scheme for that?
Yeah, as far as persistent receptive language disorder, when you talk about neurodevelopmental disorders, there are other disorders as well beside ASD, ADHD, and learning
So this
difficulties.
is not part of the neurodevelopmental disorder then, right?
It is, it is, it is.
Okay.
Communication disorders are also there in neurodevelopmental disorders. There are developmental coordination disorders, motor disorders, etc. Even intellectual disability also falls under the umbrella of neurodevelopmental disorders. So
Hmm.
when you talk about communication disorders, there is receptive language disorder and expressive language disorder. When you talk
Hmm.
about receptive language disorder, you are not able to understand language. एक तो होता है ना कि आप express कर रहे हैं, बोल रहे हैं, production of
बिल्कुल
language होती है.
बिल्कुल
But when you
बिल्कुल।
talk about receptive language disorder, you are not able to comprehend the information you're getting from the environment or from people. आपको समझ
True.
नहीं आ रही, आप understand नहीं कर पा रहे. So
बिल्कुल।
that is all about receptive language disorder. But
Hmm.
yes, this could be a part of autism or other neurodevelopmental disorders. But अगर सिर्फ यही problem है कि बच्चे की comprehension affected है, फिर हम कहते हैं ये बच्चा receptive language disorder के अंदर आता है. या अगर सिर्फ production of language का problem आ रहा है, बाकी कोई features नहीं है, तो we call it कि इस बच्चे को हो सकता है कि expressive language disorder हो, क्योंकि वो express नहीं कर पा रहा अपनी language.
बिल्कुल बिल्कुल।
समझ तो रहा है, but
हाँ,
बता नहीं पा रहा, बोल
बता
नहीं
नहीं
पा
पा
रहा,
रहा है।
express
हाँ,
नहीं कर पा रहा.
इसी से रिलेटेड एक और सवाल आ गया जहन में कि कभी कभार हमें we have these difficulty in managing social interactions found in people with autism actually, क्योंकि वो socially घबराते हैं या नहीं social हो पाते due to their poor maturation synapses उनकी जो होती है, नहीं वो socially interact कर पाते। इसको किस तरीके से हैंडल करें?
Well, social interaction, impairment in social interaction is one of the major factor which is found in autism spectrum disorder. And
Right.
ज़्यादातर जो हम diagnose करते हैं children who are on the spectrum, वो इसी वजह से करते हैं because they are least interested in social interaction. They are not
हाँ,
bothered at all. Whatever is going around them, they're just not bothered. They're self-absorbed. अपनी दुनिया में गुम है.
exactly.
हमारे यहाँ पाकिस्तान में जितनी अवेयरनेस जिन जगहों पे नहीं है, वहाँ तो कहते हैं कि साई है, इसको मजार पे छोड़ाओ, इस तरह के
हाँ,
कॉन्सेप्ट नहीं है.
एग्जैक्टली, उसको वहां छोड़
Right?
के आ जाते हैं। हाँ,
बिकॉज दे आर ब्लेस्ड एंड वो बोल नहीं रहे, लोगों से बातचीत नहीं कर रहे, मिलना जुलना नहीं होता, अलूफ रहते हैं, तो उनको वो कहते हैं कि यार ये तो ब्लेस्ड हैं, इनसे दुआ कराओ, इनको मजार पे छोड़ाओ. बट आई वुड लाइक टू
नहीं,
टेल
वो
यू
कभी
दैट
कभार एक और वो
अल्हम्दुलिल्लाह
नेक्स्ट लेवल पे चले जाते हैं अस्मा, कि वो कहते हैं कि इनके ऊपर तो कोई जिन का साया हो गया, कोई
जिनका साया है, पोजेस्ड हैं. यस, दैट ये डिफरेंट, बहुत सारी डिफरेंट कैटेगरीज हैं लोगों की जो डिफरेंट उनके पर्सपेक्टिव्स हैं. बट एक्चुअली आई थिंक देयर इज दिस पॉजिटिव थिंग. आई फील आई कैन से कि पाकिस्तान में भी काफी हद तक अवेयरनेस आना शुरू हो गई है, क्योंकि पहले मुझसे बहुत सारे पेरेंट्स आके कहते हैं
That's
कि क्यों
because
ये
of you
इतना बढ़ रहा
people,
है.
because in these days, in recent years, psychology is one of the subjects that lots and lots of people, especially women, are really going towards it, and bringing that knowledge back to the community, which is really important. A few years ago, psychology, I mean, they would think it's a very dry subject, and who wants to go and study psychology and
And
psychiatry.
there is a stigma attached to psychology as well.
हाँ,
People who
हाँ,
are studying psychology are
हाँ,
actually
वो
psychos
खुद जो है
themselves.
ना वो सरके हुए होते हैं।
गॉन केस होते हैं. एक्चुअली इट्स नॉट लाइक दैट. हाँ,
It's
उन
not.
उन लोगों के लिए इट कुड बी ट्रू फॉर पीपल जो बहुत सेंसिटिव होते हैं और अपने ऊपर ही लेना शुरू कर देते हैं सारे डिसऑर्डर्स को. यू कैन से
मैंने
कि
ये
हाँ
देखिए,
उनके
आप
साथ
सबसे पहले मैंने आपसे ये पूछा था कि डू यू गेट इमोशनली अटैच, एंड दिस इज व्हाट हैपेंस व्हेन यू गेट इमोशनली अटैच्ड टू द पेशेंट, यू नो। वो
एग्जैक्टली.
आप अपने ऊपर लेना शुरू कर देते हैं, आप अपने ऊपर तारी करना शुरू कर देते हैं वो चीजें, एंड यू गेट डिवर्टेड इनटू अनदर डायरेक्शन व्हिच इज नॉट राइट।
Exactly, that's true. So awareness about these disorders are very important, and I'm glad to say कि बहुत सारे पेरेंट्स अब आके कहते हैं ये इतना बढ़ क्यों रहा है, वो बढ़ इसलिए रहा है कि लोगों को अब पता चलना शुरू हो गया, पहले भी था, ऐसा नहीं है कि
पहले भी
पहले
था,
प्रेवलेंस नहीं थी,
एग्जैक्टली।
पहले भी था, लोगों
हाँ,
को आगाही नहीं थी, they were not aware कि these are
awareness
different
नहीं थी।
problems.
हाँ,
And the main problem with autism is that नजर नहीं आता, you
नजर
can't
नहीं
pinpoint कि इस बच्चे को
आता।
autism है. Like if you talk about Down syndrome, you can टेल इट वेरी इजीली, आप उस बच्चे की अपीयरेंस देख के बता सकते हैं कि दिस चाइल्ड इज विद डाउन सिंड्रोम. बट व्हेन यू
हाँ,
टॉक अबाउट ऑटिज्म, उसको आप देख के नहीं बता सकते क्योंकि कोई
हाँ,
खास फीचर्स नहीं है.
right,
Unless the child is exhibiting different kind of behaviors which are associated with autism, you can't pinpoint कि इस बच्चे को autism है. डाउन
बिल्कुल।
सिंड्रोम में you know कि वो बच्चे बड़े गोल मटोल से होते हैं, upward slanting eyes होती हैं, जबान बाहर की तरफ होती है, बहुत हैप्पी गो लकी चिरपी से बच्चे होते हैं, म्यूजिक
बिल्कुल
लवर्स होते हैं,
ट्रू।
फ्रेंडली होते हैं.
राइट।
बट ऑटिज्म में क्या होता है कि उनके कोई फिजिकल फीचर्स नहीं है, उनके जब कोई रेपिटेटिव बिहेवियर्स वो आपको शो कर रहे हैं, या अलूफ हैं, सेल्फ एब्जॉर्ब्ड हैं, कम्युनिकेट नहीं कर रहे, अपनी नीड्स नहीं बता रहे, या कोई रिस्पॉन्स टू नेम, सबसे इम्पोर्टेंट जो आपका जैसे सोशलाइजेशन का बात कर रहे थे, तो उसमें दे डोंट रिस्पॉन्ड टू देयर नेम. आप
हम्म।
किसी बच्चे को बुला रहे अहमद इधर देखो, ही विल
हाँ,
नॉट रिस्पॉन्ड टू यू, वो
मैं देख
पलट
नहीं
के नहीं देखेगा.
रहे।
बट ऑन दी अदर हैंड अगर बेल बज रही है वो बच्चा फौरन भाग के जाएगा, या मोबाइल की बेल बज रही है तो फौरन से फोन उठाएगा.
ट्रू।
इट मीन्स कि उसकी हियरिंग परफेक्ट है. द
बिल्कुल।
प्रॉब्लम इज ही डजंट वांट टू हियर, उसको सुनना ही नहीं है, उसको परवाह
कंप्रीहेंड
नहीं
नहीं
है कि
कर
आप
पा रहा
उसको बुला रहे हैं.
उसको। बिल्कुल।
ठीक है, तो उसके लिए उसको ट्रेन करना पड़ता है, आई कांटेक्ट का इशू आता है. बट इनको इन चीजों के लिए ट्रेन कैसे करना होता है, इनके लिए डिफरेंट थेरेप्यूटिक इंटरवेंशंस हैं हमारे पास, एंड वी ऑलवेज गो फॉर एन एक्लेक्टिक अप्रोच. यूजुअली एक हमारे यहाँ अक्रॉस द वर्ल्ड कहूंगी, नॉट ओनली इन पाकिस्तान, एक परसेप्शन है कि एबीए इज द बेस्ट थेरेपी फॉर ऑटिज्म. बट इफ यू आस्क मी एंड मेनी अदर प्रोफेशनल्स, we should always go for an eclectic or multidisciplinary approach, which actually means that you need to go for a combined approach. You should see what is the need of the child. If the child is exhibiting some behaviors, you can go for behavior management or applied behavior analysis. If the child is showing some sensory issues, hypersensitivity or hyposensitivity, तो उसके लिए आप sensory integration therapy की तरफ जा सकते हैं और occupational therapy की तरफ जा सकते हैं. Communication issues आ रहे हैं, speech issues आ रहे हैं, you can go for speech and language therapy. Socialization के problems आ रहे हैं, you can go for social skills training. So it depends कि बच्चे का प्रॉब्लम क्या है, एंड अकॉर्डिंग टू द नीड ऑफ द चाइल्ड यू चूज अ थेरेप्यूटिक इंटरवेंशन. And socialization can easily be done using different strategies, social stories, social skills training. These are different methods which we use for children who are on the spectrum and even adolescents and adults. Because जब बच्चे अर्ली ईयर्स में होते हैं तो हम बेसिक बिहेवियर मैनेजमेंट, स्पीच थेरेपी, इनके ऊपर काम कर रहे होते हैं. बट 10-12 अबव जब होते हैं तो सोशल स्किल्स ट्रेनिंग के ऊपर आते हैं लेटर इन लाइफ. ऑल्दो ये शुरू से होनी चाहिए, बट हार्डली पीपल डू दैट. लेकिन इट रियली हेल्प्स. सोशल स्क्रिप्ट्स हैं आपके, सोशल नैरेटिव्स हैं, एंड रोल प्लेज, वीडियो मॉडलिंग, दे आर वेरी इफेक्टिव फॉर सोशल स्किल्स ट्रेनिंग. क्योंकि बच्चे व्हेन यू टॉक अबाउट ऑटिज्म, दे आर विजुअल लर्नर्स, देख के सीखते हैं. इमिटेशन के थ्रू आप उनको मॉडल करके दिखाएंगे, दे विल लर्न फ्रॉम यू.
एक और सोशल होने के हवाले से एक और जहन में सवाल आ गया कि एक और जो नेगेटिव इम्पैक्ट है. अच्छा, थोड़ा सा मैं इसके लिए प्री बिल्ड करता हूँ कि यहाँ पर नॉर्थ अमेरिका में, स्पेशली इन कनाडा, अब हो ये रहा है, और पाकिस्तान में भी अब ये ट्रेंड आ रहा है कि पहले तो स्पेशल एजुकेशन जो है वो स्कूल्स अलग से लोगों ने बनाए हुए होते थे. हुकूमत या प्राइवेट इदारे जो भी हैं वो एक स्पेशल स्कूल्स बनाते थे. लेकिन अब ट्रेंड ये आ गया है कि नाउ दीज स्पेशल चिल्ड्रन विद ऑटिज्म एंड ऑल दीज काइंड ऑफ थिंग्स, दे आर नाउ put into the same schools with regular children, you know, with regular abilities. अब उसमें उसका एक तो फायदा ये है कि they get to mingle and they are learning the same things in a different way, but again they are learning the same things, or interaction or socially connection और वो सारा कुछ हो रहा है. But again इसके साथ साथ there is something which is called bullying actually. So bullying among young people is a big problem, and it's across the board. कोई रीजनल नहीं है कि नॉर्थ अमेरिका में ज़्यादा है, पाकिस्तान में नहीं है, पाकिस्तान में भी है, यहाँ पर भी है. तो क्या कहेंगे आपके ASD और ADHD के जो बच्चे हैं, उनमें बुलिंग को किस तरह वो हैंडल करें?
Actually, what you're talking about is inclusive education. We call it inclusive education generally. Like इन अ नॉर्मल सो कॉल्ड नॉर्मल जो हमारे टिपिकल चिल्ड्रन के स्कूल होते हैं, 80% we accommodate normal children and 20% we accommodate children who are with different abilities, right?
Exactly.
And we
Yes.
do have some resource teachers or some special need assistants
We
and
just spend
senkos
extra
over there.
time with those special needs
Exactly.
children. Yes.
And usually the pattern is that the child is sitting with this SNA or resource teacher, and the resource teacher is there to guide the child for all the lesson plans and everything, right?
Hmm.
But the thing, when you talk about bullying, it is, yes, very common. Bullying to generally बहुत ज़्यादा common है, and when you talk about children who are with different abilities, they are more prone to it. Reason
Exactly.
being that the other children, the typical children, they are not aware of their different abilities. उनको क्या है कि आपको जाके टीचर्स हैं, दे मैटर अ लॉट, योर पेरेंट्स ट्रेनिंग, दिस मैटर्स अ लॉट, कि आपके पेरेंट्स ने आपको किस तरह गाइड किया है, ट्रेन किया है, कि अगर आपके सामने कोई इस तरह का बच्चा आता है तो हाउ यू हैव टू ट्रीट विद दिस काइंड ऑफ अ चाइल्ड, कि आपने उनको अवेयरनेस दी इस बारे में, या फिर जो आपके टीचर्स हैं, हाउ दे आर टेलिंग यू अबाउट द चाइल्ड, हाउ दे आर ट्रीटिंग यू, या उस बच्चे को किस तरह ट्रीट कर रही है वो टीचर आपके स्टूडेंट्स के सामने, दिस ऑल्सो मैटर्स. सो आई थिंक यहाँ पे टीचर का और पेरेंट का बहुत इंपॉर्टेंट रोल होता है कि वो किस तरह से अपने स्टूडेंट्स को सिखा रहे हैं, ट्रेन कर रहे हैं कि इस डिफरेंट लेवल बच्चों को किस तरह से आपने मैनेज करना है, उनको सपोर्ट करना है. एंड आई वुड लाइक टू मेंशन हियर कि हम लोग यहाँ पे जो पेयर रीडिंग है, इंक्लूसिव एजुकेशन में पेयर रीडिंग या पीयर रीडिंग, इन दोनों को हम बहुत ही सपोर्ट करते हैं. किस तरह से कि जो डिफरेंटली एबल बच्चा, उसको किसी एक टिपिकल बच्चे के साथ हम बिठा के पेयर रीडिंग कराते हैं, ताकि उसमें फायदा क्या होता है कि दे कैन एक्चुअली सपोर्ट. एट टाइम्स हमें लगता है कि शायद ये बच्चे अंडरस्टैंड नहीं करेंगे, बट वंस यू ट्रेन देम, वो बहुत अच्छे तरीके से अपने सिबलिंग को, अपने पीयर को सपोर्ट करते हैं कि यस यार ऐसे नहीं, ऐसे करो, यू नीड टू डू दिस, ओके हियर यू गो, एंड उसको पंप अप भी कर होते हैं, यस यू कैन डू इट. ये सब चीजें भी हो रही होती हैं. एंड इनफैक्ट अगर कोई आर्ट एक्टिविटी या म्यूजिक एक्टिविटी या कोई गेम वगैरह ये स्पोर्ट्स में है, they always support them, only the thing is that you need to train them appropriately, फिर तो हो जाता है. अदरवाइज बुलिंग होती है, एंड बुलिंग जब होती है तो ये बच्चे तो आपको रिपोर्ट भी नहीं कर पाते, दे आर नॉन वर्बल, या बहुत लिमिटेड स्पीच है, वो आपको नहीं बता पाते. तो वहां पे टीचर्स नीड टू बी वेरी विजिलेंट कि इस तरह का कोई मिसहैप ना हो जाता है, बट होना नहीं चाहिए.
वो हर वक्त देखे, टीचर कैन नॉट बी अटैच्ड टू दीस काइंड ऑफ किड्स ऑल द टाइम.
बिल्कुल. तो they need to be like cameras should be there so that इस तरह का कोई इंसिडेंट हो जाता है तो आप उसको केयरफुली करें. एंड ट्रेनिंग, पेरेंट्स ट्रेनिंग एंड टीचर्स ट्रेनिंग इज वेरी इंपॉर्टेंट इन हियर.
Acha, there are so many other questions, Asma, that I have lined up for you. एक last question पूछूंगा मैं, then we will hop on, and we still have to talk about ADHD and other neurodevelopmental issues. We haven't even touched ADHD. I think we need another show because we lost some time on this show. Maybe after a few weeks, let's schedule another show and continue with this topic. Because we have to go through the UNQ as well, and lots of people like that segment, and it's on a lighter note. My next question to you is, there are some psychological issues and there are some psychosocial issues, right? So what do you think, what are the psychosocial effects that having a child with the neurodevelopmental disorders or condition has on the parents and or on the entire family?
Well, a lot of psychosocial factors are there, because the first thing that parents go through is denial. You need to make them accept the fact that they do have a,
नहीं हो सकता.
हमारे बच्चे को ऐसा हो ही नहीं सकता. कोई बात नहीं, इसके फादर भी देर से बोलना शुरू हुए थे, ऐसा नहीं है, बोलना शुरू हो जाएगा, कोई बात नहीं, एक साल और देख लें.
By doing that, right? Don't they?
Exactly, this is their defense mechanism actually. If you talk about some technical term, this is their defense mechanism, और denial की तरफ चले जाते हैं. But you need to guide them, you need to psychoeducate them, counsel them. But once the parents accept, this next problem is family को बताना. This is a big issue, especially here in Pakistan. जैसे हमारी अगर joint family system है, आपके in-laws है, आपके घर में बहुत सारे लोग हैं, multiple लोग हैं, उनको समझाना, बताना कि yes, हमारे बच्चे को ये different ability है, ये problem है, इसको आपने किस तरह से handle करना है, घर में किस तरह से उसको manage करना है, आप नहीं कर पाते. बहुत सारे प्रॉब्लम्स मदर्स को, पेरेंट्स को फेस करने पड़ते हैं कि मैं ये करना चाहती हूँ, बट यहाँ पे मेरे घर में फलाना XYZ पर्सन है, वो मुझे कहते हैं नहीं ऐसे करो, नहीं ऐसे नहीं ऐसे करो. हालांकि जो पेरेंट्स हैं, दे वांट टू फॉलो व्हाटएवर इज बीइंग टोल्ड बाय द प्रोफेशनल टू देम, बट वो उसको उस तरह इम्प्लीमेंट नहीं कर पाते.
नहीं
एंड
कर पाते.
मेजोरिटी इसकी वजह से बहुत सारे केसेस ऐसे हैं जो जॉइंट फैमिली में पेरेंट्स रहते हैं और उनके बच्चों को इस तरह की कोई डिफरेंट एबिलिटी हो जाती है, दे
True.
गो फॉर अ सेपरेट न्यूक्लियर फैमिली देन.
Yeah.
रीजन बीइंग कि दे कैन इम्प्लीमेंट डिफरेंट स्ट्रेटजीज अकॉर्डिंगली.
बिल्कुल.
लेकिन जॉइंट फैमिली के अपने पॉजिटिव्स हैं, न्यूक्लियर फैमिली के अपने पॉजिटिव्स हैं. जॉइंट फैमिली के पॉजिटिव्स ये हैं कि जो न्यूरो डेवलपमेंटल डिसऑर्डर्स के साथ बच्चे होते हैं उनकी कम्युनिकेशन बहुत डिस्टर्ब्ड होती है, अफेक्टेड होती है. तो जब जॉइंट फैमिली में होते हैं तो सब लोग बहुत बातचीत करते हैं, कम्युनिकेटिव होते हैं.
Exactly.
न्यूक्लियर फैमिली में क्या है कि अगर फादर चले गए जॉब पे, मदर सिर्फ घर में, एंड मदर भी बड़ी रिजर्व नेचर की हैं, तो बच्चा तो फिर स्क्रीन टाइम पे लगा रहता है मोस्ट ऑफ द टाइम मोबाइल के
नहीं, या
साथ. एंड
तो
उसकी जो
रिजर्व नेचर की हैं
कम्युनिकेशन
या
है,
सोशल नेचर की हैं, हर वक्त फेसबुक और इंस्टाग्राम के ऊपर है.
एग्जैक्टली तो वहां पे प्रॉब्लम आती है. एंड अदर साइको सोशल फैक्टर्स है के अगर आप मॉल में जा रहे हैं, ग्रोसरी स्टोर में जा रहे हैं, आपको ऐसे देखेंगे स्टेयर करके अगर आपका बच्चा कोई बिहेवियरल प्रॉब्लम शो कर रहा है, मॉल में रो
हाँ,
रहा है, जमीन पे लेट गया है, तो
बिल्कुल.
पेरेंट्स को बहुत प्रॉब्लम फेस करनी पड़ती है. लोग ऐसे घूरना शुरू कर देते हैं, इंस्टेड ऑफ सपोर्टिंग द पेरेंट वो वहां पे घूरना शुरू कर देंगे, कमेंट्स पास करना शुरू कर देंगे कि इनको तो अपने बच्चे को हैंडल करना नहीं आता, ये है वो है. बट द प्रॉब्लम इज विद देम, दे आर नॉट अवेयर ऑफ द प्रॉब्लम ऑफ द चाइल्ड. उनको पता ही
एग्जैक्ट.
नहीं कि बच्चा किस चीज से सफर कर रहा है. आई
हाँ,
ऑलवेज
बिल्कुल.
से कि इट्स नॉट बिकॉज ऑफ द चाइल्ड कि उसके साथ कोई मसला है, हमारे साथ मसला है कि हम उसको अंडरस्टैंड नहीं कर पा
नहीं
रहे.
कर रहे.
बिकॉज आम अल्फाज में अगर हम कहें तो न्यूरो डेवलपमेंटल डिसऑर्डर्स में मोस्टली क्या होता है कि बच्चों की ब्रेन की वायरिंग फर्क है, उनके सोचने समझने का तरीका हम लोगों से मुख्तलिफ है. सो
डिफरेंट है.
द वे दे परसीव थिंग्स इट इज डिफरेंट फ्रॉम अस.
ट्रू.
सो द प्रॉब्लम इज विद अस कि हम उनको अंडरस्टैंड नहीं कर पा रहे.
वेरी ट्रू, वेरी ट्रू. बिल्कुल. चलें, बहुत ज़बरदस्त गुफ्तगू हमारी रही. बहुत ही कलील वक्त हमें मिला बात करने के लिए, बट आई एम ग्लैड कि नेटवर्क स्टेबल हो गया आपका. और we'll definitely be continuing, viewers will definitely be continuing this topic at a later date, and stay tuned to hear more about the other learning difficulties in ADHD and the impact of these neurodevelopmental disorders into people and people around them. Actually, that is important. But let's hop on to the next segment, which is UNQ, quickly, because I have to run and I have to host another show right after this. All right. So this segment has this segment has subsegments. There will be three actually subsegments to this. First one is, tell me your 3 good habits and 3 bad habits.
3. Oh my god. Bad habits. I trust people very quickly.
Okay.
And I think I don't know, 3. It's a very difficult question.
Okay.
I can empathize really well. I communicate well.
That's a good habit. Okay.
Yeah, and one more weakness. I am a sensitive person. At
Yes.
times, this becomes my weakness,
Okay.
and I trust people very quickly. This is a weakness. That's it.
Okay. Good. So let's hop on to the questions. There will be 2 multiple choice questions. There is a movie being made in Pakistan, and you are a heroine in that movie, and you have signed a contract, so there's no way out. You have to do it, and you are allowed to pick a hero to work beside you. I'll give you a few names. You have to pick one of them. You cannot pick anyone
Okay.
else. ठीक है? फवाद खान, हमजा अली अब्बासी, एहसन खान, इमरान अब्बास, फैसल कुरैशी और शान.
Well, tough one. Fawad Khan, maybe?
Fawad Khan, okay. So the second question is, you are still the heroine in that movie, and you are given the option to pick a side heroine. And I'll give you a few names. You cannot pick your bestie or your sister. Sanam Baloch, Mawra, Myra Khan, Sabah Kamar, or Mehwish Hayat Khan.
Sabah Kamar.
Sabah Kamar, of course. Awesome, awesome. Great. Azan ho rahi hai, viewers, and I wish we could do this segment. Challenge. Why don't we keep this segment for the next time, because Azan is going on and I have to run too.
Yeah.
Right. So thank you so much, and we will not conclude this show as we do normally by thanking you. I'll thank you in the next show. All right.
But I would like to say sorry for all the inconvenience that our audience faced and you faced due to the power outage and other net issues. But definitely, I'll try to make sure ऐसा कुछ ना हो next time. And I hope to talk further about all these disorders. And we'll also continue with psychological disorders as well, not only to the neurodevelopmental disorders.
True.
Sure.
True.
Thank you very much for inviting me. It was a pleasure.
Bye now. Viewers, apologies because I have to hop on another show in a few seconds, actually. But thank you so much. I wish there were no network issues and we could have spoken to Ms. Asma Ahmed a little bit more about the rest of the topic. But rest assured that we'll bring her back on the show to talk about these things. I wish you all the best. Thank you so much for watching the Aijaz Qureshi show, and we will definitely be back with you again at a later time. Until then, take care of yourself. Assalamu alaikum.